Alrighty, out of respect for Councilor Wu's time and the time for everybody that's on the Zoom right now, I want to welcome you and thank you for joining us for this afternoon's Stand Against Racism lunchtime conversation with City Councilor at Large Michelle Wu. My name is Beth Chandler and I am the President and CEO of YW Boston. For over 150 years, YW Boston has been dedicated to eliminating racism, empowering women, and promoting peace, justice, freedom, and dignity for all. We engage individuals and organizations across the city to create more inclusive and equitable environments for women, people of color, and women of color in particular. For 10 years, we've participated in a nationwide YWCA movement called Stand Against Racism. Every year, the STAND campaign brings together people from all walks of life to raise awareness and empower action toward eliminating racism. Each April, we provide participants with prompts and tools to facilitate conversations about racial equity, ultimately propelling them to take action toward building more just communities. We are thrilled to have City Councilor at Large Michelle Wu facilitate today's lunchtime discussion on the content she selected for this year's stand, which focuses on the connection between systemic racism and public health. Councilor Wu is a daughter of immigrants from Taiwan. She is also Boston's first female Asian American city councilor and was the first woman of color to be councilor president. Councilor Wu has been a national voice for bold progressive action at the local level, authoring successful legislation for paid parental leave, healthcare equity, prohibiting discrimination on the basis of gender identity, procurement reform creating equity and opportunity for city contracts, language access, and healthy food purchasing. She is also a wife, parent, and Razi resident. Go Razi. Before I pass it over to Michelle, to help facilitate today's discussion, we have two ways for people to engage. First, there will be an opportunity to ask Councilor Wu questions. And for the question portion, for the question that will be answered out loud, there's a raise the hand function in the participant section. So use that and Councilor Wu will call on people and then we will unmute you to ask your question. And secondly, you can also ask and answer questions with fellow attendees through the chat. With that said, again, I'd like to welcome Councilor Wu and thank you so much for taking the time today to lead the discussion, particularly given all that's going on in the city and all the responsibilities you have as a counselor, as a mom, as a spouse. Just want to say your Stand Against Racism content is particularly relevant given the racial disparities laid bare by the current novel coronavirus pandemic. So thank you again for leading this really important conversation.
Thank you so much, Beth. I am really honored to be part of the campaign and to have known and seen the work that YW has been doing in Boston. It's definitely setting the tone for cities across the country as well. I've had the chance to partner a little bit with YWs in other parts of the United States as well, and everyone always looks to Boston. And I know just how many campaigns and issues that Beth is taking on in her role, part of other coalitions. So I'm very, very honored to be sharing this screen, I guess, with you and here with everyone today. So just so you all know, I am going to be looking off to the side because I have two devices open. I was explaining to the team earlier, my internet on my laptop is very slow. So sometimes I get frozen if I'm using that. So I'm looking and talking to my phone. But then I have the laptop open so I can see everyone's pictures and lovely faces and names. And that's how we'll do some of the moderating function with the blue hands on Zoom. It's great just scanning down this list to see some familiar names and to see so many people who are interested in standing with us and engaging on this content and this topic, which, as Beth said, has just taken on a lot of extra resonance right now. I think we were collaborating on submitting this material maybe in February, or it was well before COVID was on the scene. And early on, I felt that what we need to do in Boston, there are lots of particular issues that people talk about, challenges around housing or climate or transportation, schools. But fundamentally, what we're always talking about is whether we can mobilize the political will to address structural racism, right? All of these issues, yes, they cost money. Yes, it takes coordination. Yes, it's about community partnerships. But Boston is lucky because we have so many resources on all those fronts, right? We have great wealth and resources in the city. We have incredible expertise and many, many institutions who have been leading the way. We have, I'm convinced, more civic energy per capita than anywhere else. You know, you see it in neighborhood associations and organizations. And so at the end of the day, it always is about political will. What do we want to address together? What are we prioritizing in our response? And you know, there are two things that I've taken from COVID and this pandemic. It's that the issues that we are now talking about as a crisis in this moment were always crises for our communities before, for communities of color, for low-income families. They were just not as sudden shock as a virus kind of descending on the world. But the other half that I take from it is that we look at this incredible mobilization of resources that we are seeing right now when we do decide to address a crisis, right? People are, you know, now that we're getting the president finally acknowledging it, we are seeing a ramping up of material production for PPE, the personal protective equipment for frontline workers. We're seeing the resources made available for housing stability that people have been asking for a long time. The T is free right now. Buses are free because the MBTA finally recognized that to allow for greater safety and space distancing, people should be allowed to board on all doors, and so they're not collecting fares on the buses. So many of the issues that we're highlighting now both demonstrate the issues that were there before, but also the ability, the potential we have to solve them. So at the heart of how I think about solving issues is this intersection between structural racism and public health. It undercuts everything else that we talk about. So I'm really excited that everyone has engaged on these materials. We did have a hearing yesterday on how to plan for an equitable recovery from COVID that wrapped up a few of these strands as well. So if you're interested, I can share that video so you can follow along, and we have some more next steps coming out of that hearing that was co-sponsored by Ricardo Arroyo and Juliet Mejia and myself. But now let's dive into the material, and I'll start with the questions that we had posed. We'll kind of dedicate a little bit of time for each one, and I know we have a lot of people on board, so you know, we've kind of broken up the rest of this hour into 10 minutes per prompt, per question. And obviously you should feel free to respond, not just with answers, but your own questions, and we'll be very flexible and keep it conversational. But because there are so many people who want to speak, if you can kind of be concise and just be mindful that there are others who have room to speak, and we can, you know, also have a very active chat. I'll try to keep my attention on both as well. So the first question that I was hoping to get everyone's thoughts on, how does structural racism in the systems that you see or experience in Boston impact public health across all communities in the city? Okay, and let me see, again, you can just use the raise hand button on Zoom, and then that little blue hand will pop up next to your name, and I'll call on you. I don't know if everyone has been familiar with Zoom already and probably been on many, many Zooms at this point, but let's see. You can access that, at least I think it is, team, correct me if I'm wrong, if it's in the participants. If you click on manage participants, there's a raise hand button. The reaction button. Okay, thank you. So if you click on the reaction button, then I'll see it next to your name. Okay. So Let's see if ever anyone pops up. Okay. I'm not seeing anyone raising their hands just yet. I'll give a little more time. Let me check the chat. Oh, okay. Repeat the question. Yes. How does structural racism in the systems that you see or experience in Boston impact public health across all communities in the city? Okay, I'm scanning down the list. Okay. Cheryl A. Thank you for volunteering. Let me see if I
Am I
can
still
unmute.
muted?
There you go.
Okay, there I am. Hello, Councilor Wu. Thank
Hi,
you.
Miss Cheryl.
How you doing? So how I'm interpreting this, I discovered there were several folks that I knew that went to the hospital, and because of insurance issues or maybe they were supposed to check with the insurance. It was kind of a lot of things were said to them. This was earlier on. I think things might be a little bit different now, but they were sent back home and then had to go back. And this is one of the things that I guess for especially people of Black or of African Americans in particular with insurance, this is something I'm thinking that we should do later on in the future is figure out a better way to help. But that's been one of the things because folks don't have they have different types of insurance. Some insurances are what's the word? They're not like if I hate to use this as an analogy, but maybe if you have Harvard and you have something else that is not as probably well known, you tend to get a different response. They give you certain amount of support, of help, but not enough. Does that kind of make sense of what I'm saying? So that's one of the things that I have noticed. And as I said, someone that actually happened, they had to go back to the hospital because of it. And then another person, and then I'll stop talking, actually went in, had the system, but their temperature was like 1 degree lower than what the standard, and they didn't help them.
Mm-hmm.
And it was all related to their health insurance.
Mm-hmm. Mm-hmm. No, thank you so much, Ms. Cheryl. I think that is so spot on. We're seeing that in every interaction with the healthcare system. There are, basically every angle of it, whether it's on the insurance side, whether you're covered, what you're covered for, based on how much you were able to pay for your plan, or whether your employer was paying at all for your plan, to even the interactions with the healthcare providers. We know way before COVID that Black and Brown residents were much more likely to be, their sort of medical concerns were much more likely to be dismissed, and even with care, not treated effectively. And so, it's just so striking if you think about, maternal mortality rates, or preterm births, or so many other ways that you could put numbers and measure it. Even controlling for the same income levels, you see such a stark difference by race. And now COVID is just so deepening that, because there's so little time you have to go to the doctor and to be tested and to get treated, and the stakes are so high right now. So thank you for that. I see one other hand raised, Andrea Kramer.
Hi. Can you hear me? Okay.
Hi, Andrea.
Hi, Michelle. Thank you. First of all, I wrote it in the notes. Thank you for the prompt, the podcast. It was amazing. I really appreciated it. Looking at gross numbers, obviously the disparities in life expectancy just from Back Bay 10 blocks over. I mean, those always shock me and hurt me. But I want to sort of answer this question a slightly different way. I hope it's useful and taken as it's meant. Is I saw something, and this was a prompt I was going to use for my stand event this year. How has your race affected you? Because we often are looking at things like, okay, what does race mean to a Black person? What does it mean to an Asian person? Without saying, what does it mean to a white person? Like, we have race too, and it has affected us, mostly in positive ways. So in answer to your question is, from a racial perspective, here's what I see. As a white person, healthcare is more available to me because of my race. I am believed when I give symptoms. I am treated with respect. I live in a safe community, and I don't have environmental toxins that are affecting my health stuff. I mean, obviously you can turn it around the other way, right? So that other races would then be negatively affected. But I look at places like Chinatown or Roxbury or Dorchester, where some of those things are not available, and race affects health, public health, over and over.
Thank you so much. And yeah, I mean, I think that's just so important to lift up and so powerful when we are bringing everyone into the conversation, and there's a clear sort of recognition of privilege, and oftentimes that's the place where we don't get in conversations about race. Is we're often talking to, you know, Black and brown residents and everybody kind of, you know, we need to make sure this is a conversation that everybody is a part of, and that is so powerful. How you've said it. I think the other issue that you drew out is the link with environmental justice. That last summer I was in Chinatown at an event where we were announcing the results from a Union of Concerned Scientists study, finding that Chinatown was the most polluted census tract in the state. And as we were standing there looking around, you could see why, right? It's surrounded by all these highways, and as we have more traffic and more cars are stuck there, just stopped, spewing the fumes into the air, we have connected that to, you know, obviously more rates of asthma. The study was announcing that it was also connected, that sort of ultrafine particulates were also connected to greater rates of heart disease and other much more serious sort of immediately deadly, not that asthma isn't deadly, but immediately deadly things that we would recognize as a public health emergency. And now we've seen the link with COVID too, that the very communities who had been more exposed to air pollution before are now much more vulnerable to COVID if they do get, you know, are exposed to the virus, then their outcomes are much worse because of that, you know, already weakened lungs and other issues. So you'll notice, I don't know if you can see my background. I am zooming in from Maverick Square in East Boston, another community that we are very conscious of, you know, being so close to the airport, that jet fuel fumes are the largest source of emissions anywhere. And interestingly enough, given who has influence in how we measure things, airports are never counted in a city's official reporting of what their carbon footprint is. And so the residents in East Boston, they know, you know, I've talked with families who say there are certain days where when we start to smell that smell, we have to take our kids inside. And we know that if we stay out, we start to feel unwell, our nose starts to, you know, you start to just get itchy and all this stuff. And it's the daily exposure to that kind of air pollution that is in fact daily exposure to structural racism. So thank you. I'm going to do one more scan for hands on question 1. And if there looks like everyone might be ready to move on to the next question. Okay. So question 2 was, would you encourage the city of Boston to make a similar declaration of racism as a public health crisis? Why or why not? Oh, wait, sorry, 1 second. I see someone in the chat saying that someone was trying to answer. Okay, Nicole, sorry to move on before seeing you. Can you unmute yourself, or I can try to find you and unmute you as well?
Oh, I'm unmuted, Michelle.
Oh.
Hi, good morning, everybody. Good afternoon at this point. But I'm glad you asked that question, because one of the things that we don't look at, the racism and then the disparities that we have, lack of healthier foods, housing, jobs. I mean, we can go down the list, but when you have to worry about if you have a place to stay, that's worriment, that's stress, that's high blood pressure. Lack of decent food for your children to eat because you don't have enough and you have to give them whatever you can that's affordable. That's sugar diabetes, that's a certain cancer, and then the job resources that are in our, we cannot live off of $15 an hour and actually think we can afford a $2,000 rent. So all of that plays a huge part in our health and how we manage. I mean, that's something that we really need to look at in Boston, that how can we manage life if we can't even have a comfortable place to say I can lay my head? So that's all I want. I want to really emphasize when we talk about racism and public health, is not always, it's about our health, but what comes along with our health, and that's job, food access, housing, transportation, all of it falls right under our health.
Yeah, and COVID is really making that just crystal clear. I talk about how there's basically a triple hit that residents of color are bearing right now with COVID. Not only are the rates higher in communities of color and in Boston and elsewhere, particularly in the African American community, but also people are more likely to be economically hurt by this because daycare is closed, schools are closed, and folks might not be able to work from home and therefore are going out and being increasing exposure to the virus. And then we're also seeing now, even in the last part of it, the relief side, the federal stimulus packages, this Paycheck Protection Program, PPP, that the federal government's putting out, even the city's own relief funds, that the people who are most likely to be left out are, again, residents of color, residents who are facing language barriers. And so we have to be very intentional. So this is something that came up at our hearing yesterday, is when you have a fund that is not enough resources to address the need, some people are going to be left out. And if you use those resources, if you choose to distribute them through an application process, through a first come, first serve, whatever it is, if you are putting barriers to getting those resources out, we are necessarily going to be leaving out the people who most need access to those resources. So instead, let's start from the other end. We know how many small businesses there are in the city of Boston. We could probably figure out which ones are in greatest need with other metrics, and with from all the issues that we're talking about before. Who doesn't own their building? Who's at the mercy of their landlord, right? Who has hourly wage workers? Whose workers are mostly workers of color? And then go directly to those businesses and say, here are resources available, as opposed to, we have this fund, you have to apply by a certain day, and the translation won't be available for a couple of days, so you can't figure out how to get there. So thanks so much, Nicole. I saw someone else who had wanted to speak. Barbara Russell.
Let me unmute myself. Am I unmuted?
Yes, we can hear you.
First of all, I'm so tickled that you're here today. I think it's inspirational, to say the least. I have a two-part question, and I'll try to be efficient. One is more of a global issue as to responding to Renee Graham's op-ed today in the Globe, which basically said that we're living in a very tough time, and these rallies that we're seeing around the country, these protests really are poorly disguised Trump rallies and completely born in racism. Once this group of people realized that a lot of COVID is focused and disproportionately on communities of color, they came out into the streets. So I guess my first question is, how do we combat this? Is it through in our educational system? Does it start in the Boston public schools, where we begin to imbue in our 6 and 9-year-olds that there's a problem, and how do we do that? How do we solve for it? Because I think all of us on this call it's bad enough that we don't have leadership nationally. We rely on you and Charlie Baker and Marty Walsh, but it's completely stressful to see these swastika carrying racists lying down and stopping emergency vehicles from getting to the hospital. So I'm looking for reassurance, but also hopefully solutions. And I'm going to forget the second part of my question because the first part was so long.
Thank you so much for that. I totally agree with the answer that you started to pose, which is that a lot of it is making sure we are empowering our young people to have every resource available to them, to make sure that civics is part of the education system. I think the way that I think of the answer in general is that it's not just about getting to the right policy outcomes, but how we are empowering people to be part of the process of deciding what those outcomes should really look like. And so that focus, the dual focus on not just, what we need to do to solve COVID and manage the public health crisis and even the economic recovery, but how are we truly going to share power with communities to implement that? I think the local level is the most powerful place to do that, because it's the level where policy isn't just policy. The policy is really about the implementation and how it happens in real life. And you can only do that effectively if you are talking with folks and listening to the people who are living the issues. I'm gonna cold call on someone because I see him lurking. My colleague from Brookline, Raul Fernandez, who's on the select board there, it would be the perfect person to add to this question. I know he is just such a solid partner in this, someone that I feel happy about just even knowing that he's in government. But Raul, the question was a little bit about how do we push back in general on hatred and racism, especially what we're seeing this flare up now.
Yeah, I appreciate that, and I've seen some of the scenes out there too, and it's just horrible to see, especially during these times. I think that that those are opportunities for us to gain more ground. And thank you, Counselor, for inviting me into the conversation. So, for instance, one of the things, this is just like pre-COVID, but not by too much. You may remember that that President Trump was going to send out. Or was sending out folks from ICE along with CBP and their SWAT teams to start going into sanctuary towns and cities and just wreak havoc is really what I think their intent was to do, and to frighten people and ultimately to also round up and deport people who weren't doing anything but trying to live their lives. One of the things that we did here locally was to use that as an opportunity to, one, call it out for what it was and say that we stand as a community against that, and we issued a statement to that effect, but also began working behind the scenes to really think about, like, what are we currently doing for our immigrant community in Brookline. So, for instance, it's really easy to say immigrants and refugees are welcome here, but what is their ability to actually move here, to live here, to be able to afford to be here, and starting to work on those longer systemic kind of issues. And so, thanks to the administration for lighting a fire under us to actually start to dig a little bit deeper, not just to solve the issues as they flare up, but to think about these longer term issues and how we can get at the root of them. So that's something that we're in the process of getting to, is finding out more about how we can participate even more in refugee resettlement in our town. What does that look like from a governmental perspective, but also for our faith communities and their support of immigrants and refugees? And what does that look like for just everyday residents that want to get involved in welcoming more new Americans to our community? So that's an example of sort of flipping that and using as an opportunity to say, not just to denounce what's wrong, but how can we actually, from a policy standpoint and from a practice standpoint, start to change things. Thanks.
Thank you for everything. yeah, I mean, I think that also brings up a good point of, you know, there's been frustration in the climate community and many other places where our usual forms of lifting our voices involve getting together physically, right, at a protest or a rally or showing up at a hearing, and we have to find new ways of doing all that during this time of physical distancing. But there's still very powerful platforms and mechanisms to do it virtually. So I would love to keep hearing all of your ideas on that, even after this session too. Okay, so as you see, I've been joined by a guest here who was banging at the door, so I had to open it. Let's move to the second question. Would you encourage the City of Boston to make a similar declaration of racism as a public health crisis? Why or why not? Okay. Let me check the blue Zoom hands to see. We had some notes before that it is in the participants tab that you can press the raise hand button, or feel free to put your name in the chat and I'll monitor and bring people in over there as well. Shout out to the other little people I see on the call here. I see Siri and the family. Hi. Okay. Adam is describing his organization called Reimagining Migration. This is following up on Raul's last point. Empowering people of color to get involved and bring people into the conversation and working to create shared narratives and identities. That is so important. Okay. Corliss, would you like to comment too? I see your written remarks in the chat. Would you like to add more to it? Okay, how about let's try an experiment. And then, oh, I see Yumiko will be next, but I want to try something. Let me see where exactly this button is. I think it's in the participants button. So if you click on participants, you'll see that one of the buttons there is a yes versus a no. So why doesn't everyone, you know, just answer the question with that yes or no button? Do you think Boston should declare racism as a public health crisis, structural racism as a public health crisis? And this is even separate from COVID as the actual racism and public health crisis. Okay, so we're seeing a lot of green lighting up. A thumbs up. Okay, Yumiko, would you like to say something?
Yes, I had a question. So I thank you for doing this. This is great. I was just wondering, what is the kind of short-term expected benefit of declaring as a public health issue? You see the long-term kind of structurally, it seems the right move and see a long-term effect. But in this current situation, is there anything that we can expect from declaring that?
Yeah, I think the other cities that have moved in this direction have acknowledged that, you know, we very much recognize that just the, you know, the language or the vote or the official declaration doesn't solve the problem, right? Certainly there are deep challenges that are generational and involve wealth creation and home ownership and education. And so many of these things will take more than even, you know, just a single year or political term to solve. But from my standpoint, as someone who's at a lot of these policy making tables, it is often just a question of priorities. And when you say something publicly, when you declare it to the world and engage in the, you know, communication of even just an intent, you're putting some accountability out there as well. And ideally, in this could happen in Boston and Brooklyn, you know, and at any municipality, it would be not just a declaration and then that's it, and, you know, ask us later how it went, but a declaration, a group of people, community leaders, or a process by which people could engage with that, developing a plan and a vision for what the steps would be, both in terms of the long term and the immediate. What I love most about city government is that there is so much that is immediate, and you can't get away with just saying that you believe in something and then not doing anything about it, because people have needs and they are, they see you at the grocery store and other places. So I think some of it is conveying and committing to a particular priority, and then hopefully through that, creating the platforms for community to get involved as well.
Michelle, this is Beth. I was wondering if we made that declaration, like, what do you think would get in the way? Like, why couldn't we just do that? What would be the impediments for, do you think people would be raising for why we can't do that, why we can't declare it?
Yeah, I think probably the one that I hear most often is, you know, there are so many issues we need to work on. Well, will this just lead to, why not declare a crisis of this or that? And should, you know, sometimes we hear that, well, what about my community, right? What, you know, what about the issues that my, you know, quote unquote, my community is facing? Part of what I think would be important in Boston taking on, or even, you know, declaring some intention, is also to frame how this truly affects every single person, right? I try to emphasize that lens when I'm talking about public transportation, because we, you know, I see it as sort of a parallel of some people drive cars, see themselves as drivers, want nothing to do with the cyclists that get in their way and this and that, and there's sometimes a little bit of, you know, hostility on that front. Some people drive cars and wish they didn't have to, but see no other realistic option. Some people identify themselves as hardcore cyclists, or people who are walking advocates, or people who are public transportation advocates. But the reality is that if we can change the conversation for how each of these groups, however they self-identify, is actually all interconnected, and the changes that will actually lead to a more sustainable future for everyone, that's how we expand the conversation and get people on board. I think it also helps generate urgency that way. So in Boston, you know, again, this all the materials, and we kind of envisioned this discussion before COVID, and then there actually was a public health crisis declaration that has been made now by the World Health Organization, by the Commonwealth, and by the city. And none of those declarations specifically said this is about structural racism at that moment. But what we have seen in the fallout is that no one can deny that this crisis is about structural racism. So in some ways we've kind of done it right, already, but how do we carry it through and make sure that we keep connecting every COVID action back to the underlying issues that communities were already facing, that residents of color had been asking for and advocating for generations? And how do we make sure that as we move into the recovery phase, these issues are still front of mind to be solved? Okay, let me check any other hands on this one, and I'll double check the chat. Okay, oh wow, so there's some great activity in the chat box. You have to name it to tackle it, from a very wise person, says Brianna Malore. Brianna's on my team. Someone joining from St. Louis and chairing the AUW's Public Policy Committee, just checking in to learn about Boston, and great, so happy to have that collaboration. Oh, okay, Pamela has a great suggestion to prioritize 5 public health issues to take on initially, then initiate actions to take on those issues and measure results over time. Change won't happen overnight, but we need to start somewhere. that is so important. And I don't want to derail our conversation about public health and structural racism, but one other sort of passion area for me that I push along with public transportation advocacy is around planning and the need to really rethink Boston's development processes. A lot of how we experience the city is through this incredible building boom, and that's the cranes downtown, that's a lot of activity in the neighborhoods. But when we develop without consulting community and setting a plan together and just kind of do yes or no or little tweaks on each developer's specific proposal for a certain parcel of land, we are not linking together all the issues, and we're not aligning our resources to be able to solve the problems that we've been lifting up in community. So we can talk about the VPDA for a long time some other time. Oh, okay, Ms. Cheryl has another question on this. Can we unmute Cheryl? Let's see if I can.
Okay, so before you move on, I had a question around the data. So there was the city of specific cities that have COVID-19 as relates to Black and Brown folks. Just wanted to know where that is, because that will also help us in thinking as we move forward how to address racism, because it's also part of a bigger picture, but part of the issue as well.
Yes. Okay, let me see. I'm actually going to try to do something on the fly and open up my inbox, because we had the latest numbers by race, and so I'll pull just some of these for you all. And while I'm looking for this, I will also mention that in addition to the public health data, that we also really need to be looking at the economic data. You know, who is applying for unemployment assistance, who is not getting it, where have the City of Boston's relief funds gone for small businesses and renters, you know, by demographics and by recipients. So that's another push that some of my colleagues are making. So let me see, I'm going to drop, maybe if Brianna, could you help me just put in the chat box the exact link of where on the Boston Public Health Commission's website people can find this tracker, but I'll read some of the numbers that we have in our latest reports. So actually, is there a mechanism to do a screen share? Let me see. Okay. I'm going to take too much time, but I think it will be useful to show this to you all. Okay, can everyone see that? Okay, great. So I'll just scroll down a little bit so you can see kind of the top lines. Right now, we are getting data by neighborhood, which we had requested. And let me see if there's the race data on this one. Okay, there is not. This particular email didn't have the racial and ethnicity breakdown. I think the link that Brianna will find will have that. Those are very broad numbers. And in fact, the data, even getting the data has been a struggle, and we've had to really fight. I think something around only 60% of the cases have accurately reported racial and ethnic data. So there's some holes there, but in general, what we see is that the African American communities, and 40% of people who are tested or more have been confirmed, and you see the disparities as we see across the country. These neighborhood level numbers are really interesting too, because they're ranked by the percent positive out of all those tested in that neighborhood. Mattapan is the highest, East Boston is next, and these are at almost 50% of people who are tested are confirmed positives all the way down. And so if you look at the bottom of the list, you know, you can see it's kind of your expectation of the groupings in Boston by race and by income, right? So Charlestown, Jamaica Plains, South End and South Boston, Allston, Brighton, West Roxbury, for folks who are familiar with Boston, are sadly, I think, what you would expect. Okay, so I will go back to this chat. Yeah, so we will report back as we get the data on the relief funds and the distribution as well. Okay, so I know we're running a little bit behind, so I'm going to try to just mention the last question, which probably we could have spent the most time on. And if you have answers, please put them in the chat or reach out and email me afterwards, because I would love, this is the part where I really want to dig in with everyone. How could Boston better engage with the city's history of systemic racism and policymaking that has exacerbated racial disparities?
And Michelle, for the data you shared, are we seeing gender, the intersection of race and gender as well? Because there have been a lot of reports about how women of color in particular are being hard hit. And are we seeing that breakout?
I will have to check the latest numbers. I mean, I think one big caveat to all of this is that testing is still so severely limited that there are far more cases and even, unfortunately, fatalities related to COVID that we're not even getting in the official channels unless that person has gone to the hospital and then gotten a test there and this and this and that. We know anecdotally, certainly, that a lot of this neighborhood breakdown as well is you know, the environmental justice community overlay, but also where people are essential workers and going to work at grocery stores and in other places where they are increasingly exposed to COVID. And certainly women of color make up the lion's share of that essential workforce. Okay, so let me double check if there are hands on, okay. So I'm not seeing blue hands in the raise hand function. I'll go to the chat box if anyone wants to chime in on this question. Okay, Adam. Adam, why don't you expand on what you put in the chat box? Oh, hold on, let me try to unmute you. There you go.
I mean, first, thank you for doing this, and I'm enjoying listening to people. I'm not planning on talking so much, but I do think that the cultural institutions in the city have a really powerful role to play, and with some coordinated programming, thinking about from the libraries down through the museums, through the MBTA, and how do we expose our stories? Every day I get the EGA. Calendar, you know, listing of, you know, events of U.S. history, right? And so the city of Boston has our own history, has our own narratives, and we should be thinking about how we use this space to tell something beyond the history of the American Revolution. Right?
Absolutely, yeah, and that's been such an important push. Did you know? You know, if you look at all of the names that are lifted up in monuments and markers and buildings across the city, it doesn't at all reflect the stories of who has built Boston and made history here. I learned when we were investigating this a couple years ago that in all of the city, there's only one statue of an Asian American, or actually of someone from Asia, of Asian descent. And it is a small statue of Confucius in Chinatown. So, you know, we have one of the oldest Chinatowns in the country with a very large Asian American population in terms of the Vietnamese community, the Chinese community, Korean American community, and, you know, and then, you know, not even to mention our incredible history around abolition and all
and we shouldn't be afraid of our difficult moments either.
Yes.
You know, I mean, I think it's one thing to tell the success. It's another thing to stand, you know, I walk on City Hall Plaza every day. I walk right where the image of, you know, during the desegregation crisis, you know, where the flag, you know, the famous flag photo. why not find a way to acknowledge these spaces?
Absolutely. And I mean, what I love about YW is that you all find a way to do that in an ongoing way with people as they are here. So the talks, the campaigns, the issues, we are, if not seeing it on buildings and on names yet, all of your programming is really focused on that and lifting up the stories of incredible resilience and strength and inspiration. So I'm going to, I want to put one more question on you all, and we won't have enough time to hear from folks on this, but if you could go to the chat box, and I just want to know, what is the one thing that the City of Boston should immediately take up when it comes to solving or moving towards a solution around structural racism and public health? It could be something very small, it could be something very big, but throw it in the chat box, and I'm gonna make sure my team and we just copy and paste it all, and we'll add it to our agenda moving forward. I think just my wrap-up thoughts before I hand it back to Beth and the team are that you know, we're really at a moment where we can all make a big difference, and that is a moment politically, you know, just thinking towards November and what it will mean for this country to make a decision on our federal leadership, which has had so much to do with the situation that we're in now. It is a moment policy-wise to really marshal our resources and direct them, align them with the longstanding challenges that we have always faced. I think it's a moment to really be connecting people. Boston will get to the point where we realize we can solve, we already have the power to solve any issue, we just don't know it, we don't act like it all the time. We will get to that point where we realize that and acknowledge it when every community feels like they have a stake in every other community across the city. So much of the work that I do is to try to create that community space. It's, you know, the fare free transportation push so people can actually literally be connected to where they're trying to go and to each other. And it's little things like trying to push for a block party on every single street as a way to build community when it's not about a political issue or necessarily a specific problem or concern, but just to bring people together. So I'm grateful for all of you. I know you are partners in the work, and please continue to reach out to me and my team because we see ourselves as most of all trying to provide a platform for the great work that's happening in the community. So I will pass it back to Beth.
Great. Well, Michelle, thank you so much for taking the time to lead this really important conversation. Your comments were so powerful, and I think the ways that you talked about both big and small, how to help better weave us together as Boston Strong, right? As a community that really thinks about everybody and not certain parts. It was really thought-provoking. I really want to thank you for that. I want to thank everybody who joined us today, and please keep these conversations going. You can continue the conversation with friends and family, colleagues on Michelle's content and other content that you can still find on our website through Stand. It's really important to not only think about and have these conversations, but also talk about what are concrete steps that you can take to address inequities in our communities and institutions. It's not just politicians like our Councilwoman Michelle Wu, but it's you as individuals. There are things we can all do to address inequities that we're seeing every day. And lastly, if you want to learn more about the programs that we do, please visit our website, ywboston.org. And again, if you are in a position to provide some financial support for us to continue this work, we would greatly appreciate it. Again, thank you all for your time. Again, Councilor Wu, thank you for your time and your time and your comments. And I wish everybody a wonderful afternoon and a wonderful weekend. Thank you. Stay healthy.